Hi, Victoria here in the Bothy therapy room, and today you're going to see the beautiful Khamsin's whole core therapy treatment for pregnancy. You've seen it before in parts, and this time I'm putting the whole thing together so that you can just sit back and completely relax. Khamsin has had a beautiful baby boy. She's doing really well. In fact, more of her family are coming to see me, including children and other relatives. Khamsin's now enjoying a normal core therapy treatment now that she's had her lovely baby, and all are doing well. So please watch and enjoy. Let's spread a little healing. So Khamsin, you're here for another treatment?
Yes.
You're having core today?
Yeah.
And you're beautifully pregnant?
Yes.
How many weeks are we?
35.
What did you originally start coming for?
A lot of pain down my right side mainly, but down the sort of sides of my pelvis.
I do have to be very careful with core therapy with some of the techniques that I use with advanced pregnancy, but I think we've managed it.
Yeah.
Is that right? Is it feeling better?
I'm feeling so much better already.
Oh, wonderful. You look like relieved.
I feel
and
so much better, and
Yeah.
my family are saying like you're so much more relaxed and happier. A lot less miserable than I was.
Warms my heart. That's why I'm in this profession. Fantastic. Okay, so let's give you a nice, lovely treatment.
Let's go for it.
Core therapy is the coming together of the neurological system, the nerves, and the immune system, whereby one talks to the other and the body is neurologically organised, which means that the brain knows exactly where needs to be healed and can get on with sending messages to that area, clearing the pathways of immune and blood circulation in order to channel energy and healing to that area. So here I am treating beautiful Khamsin, 35 weeks pregnant, to a core therapy treatment. First of all, in any core therapy, a therapist will take kinesiology tests to find out exactly where any systemic and foundational issues may lie. So, for instance, if I was to ask you, or even myself, where exactly is the root of any problems that I may be suffering symptoms with at the moment, our brains and our minds would probably not be able to answer that question. Whereas kinesiology will ask the subconscious exactly where needs to be treated, repatterned, realigned, in order to bring correct balance to the body, that it is aligned in the best possible structure for good health. So here I am explaining to Khamsin that one side of her body, which is in kinesiology terms called an IPSI test, IPSI, which means one-sided, and maybe because of where the baby's lying, maybe because of some repetitive action that she's doing just on one side of her body, for instance, sweeping, hoovering, raking, etc. All of these actions are not good for sending the pelvis and the spine twisted and off in one direction. Having found a right-sided IPSI failed test, I then anchor it and therapy localize it to make sure that it then passes, which it did. I then move on and check her contralateral test, which is the arm on one side, the leg on the opposite side. And both of those this week were strong, which is excellent. The previous week when she came for a treatment, she'd been in pain. And I noticed even though she hadn't had pain in her jaw, that the TMJ, which is called the temporomandibular joint, was slightly out of alignment, causing both contralateral tests to fail. I had given the jaw some therapy, which apparently she now tells me that it felt amazing at the time, but definitely afterwards, when she left the treatment room and for the next few days, she explained to me that her jaw felt like it was longer and relaxed, that it had descended. It wasn't gripping so tightly anymore. This also helps our sleep, which at the moment, and don't we all, we need our sleep, but with 35 weeks pregnant, she definitely needs her sleep ready for baby coming. So now I'm doing a test called a psoas test. The psoas muscles are found in the pelvis, and this test, which takes the foot out and up slightly, and I try and push downwards, as you can see. Both sides aren't as strong as they should be. There is some give there. And in order to find the reason for that, I go to the neck. So the very top vertebra, called the atlas, is C1. And that vertebra looks different to the rest of the vertebrae in the spine. It looks like a sliver of a bone. It's quite fine and thin, and it can get caught up in the base of the back of the cranium, which is called the occiput bone, especially with poor neck posture, repetitive action of neck downwards, or even with whiplash. So I therapy localized it and then retested that psoas muscle on both sides, and it went strong, which confirms for me, for Khamsin, but more importantly for Khamsin's neurological system, her brain, that between us we had found the reason for that failure. And by therapy localizing it, it adds to the list that needs to be treated during the second part of the treatment. At the moment, we're doing the first part, which is the kinesiology muscle tests. So this is called a ballet test. I'm checking to see if both of her hips are happy opening. So now I'm testing the left hip in 3 places to see if the left hip is happy opening to a small, medium, or larger extent. Now, when she came to me, Khamsin's right hip was particularly sore, and she found it very difficult even to hold those postures, let alone then hold a muscle test. So once Khamsin has rolled onto her side, I am able to get her comfortable, plenty of cushions. She makes sure that her tummy is well supported, her hips are well aligned, and of course her neck. Really important, as you can see there, that the pillow is pulled right down to the shoulder. I'm asking her to hold her little finger and thumb together, and this is another muscle test where I'm using her little finger and thumb as an SIM, a strong indicator muscle. And now I'm checking all the points of her sacrum, just to see if any point is out of balance. Of course, this is where most of the pain will be coming from, that then she then feels into the side of her hip, normally her right at the moment, and down her right leg. As you could see from the chat at the start, she's in far reduced pain, which is wonderful. It's music to a therapist's ears to hear that the actions that they are taking are making good repatterning, good effects to the body, causing no or little pain. So now I'm doing Tweenar, that you may well have seen on some of the other core therapy posts that I have shared with you over the last few weeks. And Khamsin being pregnant, she's simply lying on her side, just slightly over, so that she's not putting any pressure on baby. And I'm using both of my hands, normally one hand in a supportive position and the other hand applying a little bit of pressure. It's not too much, because when we have pregnant clients at any stage of their pregnancy, we ensure that we're not doing anything that will affect the pelvis, i.e. the position of baby. We want to make sure baby is happy and not affected by repatterning of the spinal pelvis, and can only be improved that the blood, the oxygen, and especially the blood to the placenta is not constricted in any way. So I am using one hand just to support her hip, while I'm using the other by pushing with my thenar muscle at the base of the thumb gently down on the sides of the spine. So I'm pushing down towards the floor, and she's telling me here that it feels really good, that she had felt quite strained, tight, lots of tension, especially between the scapula, the shoulder blades, and around the sacrum. I'm not doing too much around the sacrum because of the position of baby and the number of weeks that Khamsin is pregnant at the moment. This is Khamsin's third treatment. The first two were able to very gently test and then treat in a reduced area compared to today's treatment. And as in most of therapy, less is more. So quite often we will give less essential oil, less pressure, less time in a particular area than we would normally do, in order to give intention and compassion instead of applying too much. So she's really enjoying this now, and I'm shortly able to work a little bit on the hips. I can see that there is some movement there. I'm always asking Khamsin how she feels generally, but also in the area that I'm working. So I'm working now on the side of the sacrum and on the top, and over the top of the iliac, which is the hip bone. Most of the intention I'm giving here is energy and qigong rather than pressure and movement. You can see there's a little movement there, which is creating a small rocking mechanism. This is a feeling that does send us back in our minds to the cradle, that wonderful feeling of being nurtured and cared for. So this Tuina Chinese massage generally does make us feel connected to those early years of being cared for, the compassion and the nurture that we had as infants. And our subconscious will be welcoming that with open arms. In fact, anyone who does yoga, you'll know that many yoga moves not only are symmetrical, whatever we carry out on one side will repeat on the other side, but quite often will rock from one side to another. And that is such a lovely technique to introduce to our own bodies, where that rocking feeling, without us really acknowledging, noticing it at the time, will connect us back to ourselves as infants, feeling as if we're in our mother's arms, and indeed our father's arms, being loved and cared for. I'm now using both of my palms in an overlapping gesture on her sacrum. Normally we would give maybe 5, 10, 15 minutes of treatment, but with Khamsin being heavily pregnant, I'm just warming and giving intentional healing energy to the sacrum and to the right hip. I'm now working around the scapula, the deltoid, top of the shoulder, the upper back, and into the thoracics to make sure that the shoulder is flexible and loose. It's not strained and gripping onto the spine at that upper level. You can see some movement there, so that's good. It's not caught. And again, that rocking movement is just so therapeutic and nurturing. I can tell from the feel under my hands that Khamsin is deeply relaxed. So I now ask Khamsin to turn over when I'll be repeating all of those beautiful tweenar actions to her left side, making sure that the pillows are supporting and creating the correct alignment in spine, neck and pelvis. Now moving on, while she's on her back, to a wonderful check of her hips, her shoulders, her knees, her whole length alignment, where I'm just tuning into the ankles and the feet to make sure that there is no inconsistency one side to the other. I'm using my thumbs down her spine, which is the inside length of each foot. So I'm managing to show you here a little bit of close-up work on what I'm doing with Khamsin's feet. So I'm working up and down the length of the spine. This is the area for Khamsin that had been caught and tight, full of tension. And quite often when we get tension there, it's really difficult to let go of. So if we're able to work directly on the area, as I did with the tweenar, but also via the feet with these reflexology moves, then it's a two-pronged attack, and we can achieve far greater relief from stress and from tension. This is the neck area Now the lungs and round to the shoulder. Now I'm using 2 or 3 fingers on the joints on the right hand side, and again the same on the left foot, working up the spine to the head. I'm making sure that I'm not covering any of the hormonal and reproductive areas, for instance the ovaries, uterus, fallopian tubes, nor the pituitary. A nice pressure, but also while I'm doing this it stretches the whole spine out, working round the back of the left side of the neck. Giving it a really good check and a stretch. Working into the left lung. Into the left shoulder. So beautiful to receive. You can actually feel it working directly into the shoulder while working on the foot. And now those joints on the left side, the hip, the knee and the elbow. So we left Khamsin at her last appointment, having had the kinesiology muscle tests, followed by the tweener to her back, which is the realigning for the spine, just to relax the muscles and realign the spine to the pelvis and down the legs. I checked the orientation of the pelvis by holding and standing at the feet. Now this treatment continues with a nice shoulder push to relieve, relax the weight of the shoulders. And now I'm encouraging Khamsin to relax her head backwards in this beautiful neck release. You know, everyone I meet, everyone I treat needs a neck release. We all carry a very great weight of our heads on our bodies, our spine, our neck. And more often than not, perhaps, our neck is held too far forward or too far back, in that the weight of the head is exacerbated by compounding the muscles and the ligaments around the neck. So it's really important in every core treatment to ensure and encourage each person's neck to relax, release and lengthen. I'm now feeling the spine around the 7 vertebrae of the neck and deep into the occiput, which is the bone at the very base of the back of the head. As I turn the head, I'm also feeling, assessing the whole time to see how easily it turns, how far, whether I can feel any crunching or restriction while I'm turning and holding the head. I would never turn it too far or force any action. It is simply encouraged to do what it wants to do. And sometimes I also encourage with my words by asking people to take a long breath and to relax their muscles as they exhale. Occasionally I find an area within the neck that needs a little bit more time, a little bit more focus. And in this area of Khamsin's neck, it's very common to be tight at about C2, the second vertebra down. You may recall in the first treatment last week where C1 was caught, which means that it was blocked and attached to the occiput, the bone above, and it needed that neck release that I've just performed in order to help unlock C1 from the base of the scalp, which will then prove well when I retest the muscle that showed that spasm, that strain there, which was the bilateral psoas test, which we will come back to at the end. So now I'm able just to show you in a little bit closer up exactly the action that I'm performing on the neck. There are 7 main vertebrae here, from the very top underneath the occiput down, and when I find an area that needs a little bit more attention, I just I focus the intention of healing and warmth directly to that area. I'm totally focused and concentrating on sending healing to this area. You can see from Khamsin's posture that she's very relaxed. None of this is hurting at all. It all feels right. It's one of those movements and techniques that just feels the right thing to happen while you're receiving it. Having turned Khamsin's head one way and then the other, this technique of assessing and treating the spine in the neck through to the shoulders, the deltoids, really helps to release that upper tension, which is so common amongst all of us, but maybe especially amongst those carrying extra weight, another baby, another beautiful human being, and that is going to bring a certain amount of muscle tension around the shoulders, neck and upper back. Because of the angle of the couch, you can see I'm standing for this maneuver instead of sitting at the couch, because Khamsin is beautifully sitting up with her knees supported by a couple of cushions. She's very relaxed here, and I perform a few more neck releases. That is that orientation where her head is central, it's aligned beautifully with her spine, and I support her whole weight of her head while encouraging her to breathe out and release backwards, almost as if she were looking at the back wall behind her, while I support the very top of the spine in between C1 and the occiput. And sometimes I will travel slightly further down the spine, perhaps in between C1 and C2, that's the atlas and axis. And depending how that feels, I'll either carry on in that area, or I may travel a little bit further down, for instance between C2 and C3, and then carry on down the spine till I get to C7. You know, many people ask me how I remember the amount of information about the structure of the body, bones and muscles, but it fascinates me so much that I seem to have a thirst for knowledge of the anatomy and physiology. I also like to impart this information with you guys. The beautiful thing about giving a neck release is that every time it is performed, it achieves such a greater relaxation, not only in the muscles, but also you may even notice here that each time it's performed, the head and neck is able to tip slightly further backwards. This achieves such a beautiful release and feeling of freedom and height and lengthening. It achieves space in between each vertebra at the level of each disc, and also in the muscles and ligaments running alongside the spine. Beautiful feeling of lightness. And having performed the more tactile and muscular techniques of neck release, I'm now tuning into some Qigong, which is a wonderful healing treatment, which is an ancient technique, having been used primarily in China hundreds of years ago. You notice my hands and fingers are mainly based around the back of the neck and the base of the skull. My focus and intention here is directed at the healing and the heat that I am feeling through my hands and palms. I'm now feeling quite a strong tingling sensation. My palms and fingers are emitting and receiving a huge amount of heat. And heat is a wonderful feeling when healing is taking place. I move the tips of my thumbs very gently to the side of the cranium at the temporals. My fingers are still placed under the occiput, the very top of the neck. And not only am I feeling the healing, the energy, the heat, tingling, but also I'm seeing colours behind my closed eyelids. And more often than not, those colours may well be identical in shape, movement, tone to the ones that Khamsin may well be seeing behind her closed eyelids. If I was to ask Khamsin, what is she seeing right now? We may well concur. But more often than not, I'm normally silent during a treatment in order that the client is able to sink further into their state of healing. This Qigong, beautiful healing treatment is producing the most amazing effect here with Khamsin. Not only will you see that her breathing has calmed, also she is able to release her muscles completely. There is no requirement from me to perform muscle tests, nor turn over, nor to be focused on anything I say. She simply needs to relax. The energy now achieved between the two of us is achieving such a deep wavelength within her nervous system that it's almost at a state of sleep. Some clients indeed do fall into a light sleep towards the end of a treatment. Some clients may visualize beautiful and empowering self-compassion and deep introspection of the subconscious while in this beautiful state. It is an amazing feeling between therapist and client during these moments that heals as it works, heals into the future, and leaves us both feeling incredibly relaxed and at one with ourselves. We are so lucky to be able to enter this amazing state of consciousness. A little movement with my thumbs very gently implies that I'll be releasing my hands. Having updated my notes, I now very gently start to communicate with Khamsin. First of all, just asking Khamsin to take some deeper breaths, taking oxygen into the lungs, and now becoming aware of the hands. I encourage Khamsin to stretch out through the hands and then become aware of the pelvis and down the legs. Perhaps stretching slowly into one leg before stretching into the other. This is a way of communicating the brain to the body, that they're in tune with each other. Having done a few subtle and gentle movements of the lower body, I ask Khamsin to take another long deep breath and feel the breath into the shoulders and down the arms. Stretching out fingers separately, thumbs and palms, turning into the wrists. You may want to follow this as we go through the whole body, rotating into the shoulders one way and then the other. And now pushing the shoulders down. You may want to follow this. Just see if you can push down at the shoulder points by pulling the arms downwards and see if they bounce back up. It's only a very minimal movement, but it really helps release the trapezius muscle across the top of the shoulders and back. Having performed a long body stretch and a few deep breaths, we now revisit a few of the kinesiology muscle tests that weren't happy at the very start of the treatment, which you may have seen at the start of Khamsin's core therapy treatment number 1. I'm retesting the psoas muscle here. Just need to remove one of those pillows that's getting in the way. So the psoas is all to do with the lower thoracics and the very top of the neck. I test one and then the other in turn. Oh, I notice that that left one is still giving way. There isn't enough strength. I test it again just in case it's a one-off. No, there's still some movement. So I come round the couch and I just want to have a feel mid-back at about T11, T12, very base of the thoracics, to see if there's any sensitivity there when I just a little touch on the side of the spine. I'm working on the very base of the neck there as well. I've got my other hand at about C6, C7 on the side of Khamsin's right side of the neck. Now I retest the psoas and I'm putting a lot of pressure on there, but no, it's completely strong, so that's really good, and that tells me that I will need to work on that area next time I see her, if I do see her again before baby is born. Now I'm just having a few little looks at the orientation of the hips. They're feeling much better, although I haven't been able to do too much there because of her advanced pregnancy. So Khamsin is now feeling wonderful. Thank you for joining me. Please subscribe and I'll see you again next week.